want to just show you this chart just briefly before I go to these skulls. You can see on that horse I did over here, this horse's teeth are nice and level and even right there. So this chart illustrates basically the same thing. It shows you what a normal balanced mouth should look like. And then it has malocclusions. What a malocclusion is, like something is malformed, it's just basically the wear and tear on the teeth, and as the teeth wear, they become uneven and not the normal shape that they were previously. And the older they get, generally the worse they get. If they lose a tooth, then this will get longer because there's no opposing tooth right here. So whenever I do a dentistry, I usually go through this chart with a client if they're a first-time client. I like to educate them a little bit before we start, so if I start explaining something about the horse's dental condition, they have a little bit of an idea what it is I'm talking about. And here shows you a wave complex, some ramps, some rostral hooks, some caudal hooks. So and there's some compromised areas worn out excessively on top and down the bottom. So this just explains to the client what some of the problems are. This is excessive transverse ridges. It's just the ridges are a little too deep. That's what that skull that I did earlier when I did that dentistry, that's what that horse had. So this is just for the client's understanding. I don't like to do paperwork and offer them paperwork and then they don't really know what I'm talking about. So it's better to explain a little bit first and then they have a full understanding of what it is I'm trying to explain. Now I want to talk a little bit about the numbering system. When I do a horse's teeth, I put together a chart. And the chart has a bunch of numbers that are associated with all the different teeth. Basically the way it works is the upper molars, there is a 100 arcade. Okay, this is from the center incisor all the way back, the premolars to the molars, the canines and the wolf teeth. This horse actually does not have wolf teeth, but if it did, this was what a wolf teeth would look like, and it would be situated right around here. There's a tooth, let me see if I can hold that a little better. A tooth that's extracted when they do have them, and they're usually situated right about there. If you can just zoom in on that, that's a 105. The reason we take that tooth out, by the way, if you pull a bit against that tooth, it's going to be aggravating for the horse, and it's going to cause the horse to not perform properly. That's why we pull it out. And so the numbering chart system is just good for, if someone else were to work on this horse's teeth, they can see exactly what was going on. This is the 200 arcade. Facing the horse would be the upper right side, and then we have the lower molars, and the bottoms would be the 300 arcade, starting from 301 all the way to 311. And then on the bottom left, facing the horse, the 400 arcade, starting from 401, the first middle incisor, all the way to the canines, right to the back molar, 411 again. And that just, when I have my chart, that's what it is I'm referring to when I have the numbers, and I'm referring to numbers that on a wave complex or a rostral or a caudal hook or a protuberant molar. These numbers just talk about the tooth that has that problem. Now, I want to just go now and talk about malocclusions. What is a malocclusion? We talked about it a little bit in the chart. I showed you the different patterns of the horse's teeth and what causes them. Earlier I talked about eruption of teeth. And what that is, as we spoke earlier, it's the teeth that are moving down towards each other because they're supplying teeth because of the wear and tear. Here we have a horse with an excessively long tooth here. The reason that happened is the opposing tooth on the mandible had broken away at some point. It's missing. There's 1, 2, 3, 4, 5 teeth there. There should be 6. When this tooth broke away, there was no opposing tooth. Well, if there's no opposing tooth, this tooth is continuing to erupt. It'll just keep on coming down, and eventually it'll hit the jawbone. Now, I actually have a horse on my website that I did with this exact problem, but this tooth was longer, and it was actually pushing into the gum line, into the soft tissue, and caused the horse a lot of distress. So we basically cut back this tooth here and balance the mouth as best as we can. When they get this old, there's not as much as you can do for the horse except try and make them comfortable. This horse's teeth are at the end of their functional use. You can see here there's a cupping effect, a shiny, smooth effect. This area is a little bit more tooth left in it. You can even see the surface here of this tooth is different than the surface here. What happens is The tooth is comprised of three portions. The portion you see out here is the crown. The remaining tooth inside the jawbone is the reserve crown, and the very end of the tooth is the root of the tooth. And I showed you earlier when I pulled out those teeth on those younger horses, the crown, reserve crown, and the root. Well, when they start capping like this, that's because this horse has literally run out of teeth. These teeth that were once deep in the maxilla have worked their way out, and now we just have a little piece of tooth with a short root left, and that's why they get the cupping. The root portion of the tooth does not have the same amount of enamel, and therefore it doesn't wear the same as the actual crown of the tooth. And you can, I don't know if you'll pick this up on the camera, but there's almost like a serpentine pattern in the tooth. That is the enamel inside the tooth, and it's surrounded by cementum and dentin, and they're a softer material. So once the enamel towards the root of the tooth there's no enamel, you start wearing away very quickly because it's more cementum and dentin and no actual enamel to keep that tooth together. There's probably a little bit of enamel left in there, but not a whole lot. So that explains that wear pattern. Let me show you another tooth, another skull, I should say, with some really severe malocclusions. Here we have that same effect, that cupping effect, which happens with older horses, and a very long caudal hook on the upper 11s. These teeth are very uneven. You can see that. It's just a really bad situation. These teeth are not functional anymore. A horse with teeth like this is not going to be able to chew hay. What I suggest to people when they have senior horses where their teeth are too far gone, they're basically not, dentistry is not going to recover the masticating ability, I usually suggest to them that they switch the horse to a pelleted diet and a senior food. And in some cases, if they can't even chew the pellets, soak the pellets and soften it. It's really bad to give a horse hay when the teeth are like this. If they don't chew the food properly, they're going to end up swallowing larger pieces of hay. And if they swallow larger pieces of hay, they're going to have a harder time digesting it, which will make them more prone to colic and also make them more prone to an impaction. One of the vets in Norco was explaining to me that he finds a lot of the senior horses with Bermuda hay impactions. The Bermudas are very soft hay, so a lot of times they'll chew it, not thoroughly, but because it's soft, they can swallow without it hurting them on the way down. And the strands of the hay are too long and it ends up balling up and causing an impaction, and it can possibly kill the horse. So keep that in mind. If you have an old horse and it's taking forever to chew the food and you've had the teeth done properly by a person who does advanced dentistry, keeping them on hay is not really wise. I'd say pellets and senior food is just a lot safer. Now I'm going to show you probably one of the most dramatic cases you're ever going to see in horse dentistry. And this is a 25-year-old Mustang, and it has a wave complex that is almost beyond belief. Let me just put this head together and I'll show you this way. Remember, these teeth should all be level. You can see that obviously is not. The problem with this situation is these upper molars, they're overpowering and really destroyed the lower molars. They actually started wearing into the gum line and into the bone. So this horse had a lot of distress. And on this side, similar situation, it actually ran out of teeth on the upper molars. This had to have been cutting into gum and tissue. This skull I got from a horse rescue. When the horse had arrived, it was in very poor condition. Ironically, they had the local vet come and he did file some points off, but as you can see, common sense would tell you filing the points off is not going to help this horse. Now, a horse in this bad a condition, you're not going to make it eat better as far as chewing hay. What you are going to do is try to give it some comfort. It's more of a comfort float where you reduce this probably by about a ½ inch here and here and here to take the pressure away from this lower jaw. You don't want these upper molars digging into the lower mandible or the lower molars digging into the maxilla. So you're looking for just comfort and not necessarily trying to improve its ability to eat hay, because this horse should not ever be on hay with teeth this bad. This is a very strong candidate for pellets and senior food. This is a